Welcome back to East Texas Live on KETK. Right now we have Stacy and Robert with us in the living room. They're part of the Trinity Mother Francis Flight for Life team.
And they are celebrating their 30th anniversary. Hello guys.
Hello.
Hi.
Thanks for having us.
Okay, so 30 years, and you guys have been doing this for over 20, you said, each of you. What does it feel like to be celebrating 30 years?
It's actually sort of surreal. I mean, it just flies by so quickly. It's a wonderful program to work for, so I guess it's almost not like a job. So it just has gone by quickly.
What about you, Robert?
Like she said, I mean, you can't believe how fast it's gone by. I mean, it seemed like I just started working for Mother Francis, and this job is so great that time just flies.
Yeah.
So.
Well, I think people have a general idea of what Flight for Life is, but tell us a little bit of the details of what y'all do.
Sure. We are a hospital-based helicopter EMS program. Basically, what we do is we take emergency services out to a patient. We're like essentially an ambulance that flies rapid transport, but we also provide critical care. Okay. So in the event that a patient has a critical injury, or if their illness leads them to need critical care services, we're able to provide that, basically like taking an ICU or an ER to the patient. So some of the services that we have are we can use ultrasound, we have drips and medications that'll help folks that have had a heart attack or stroke or things like that.
Well, this sounds like kind of a high stress job. I mean, how do you train and prepare for this?
Well, we require you have like 5 years ER or 5 years ICU experience for the nurses, and for the paramedics they have to be the lead paramedics on a busy ground ambulance service for at least 5 years, and then after that our education is just ongoing. Yeah.
Never stops. That's pretty insane. Yeah. In terms of the helicopter itself, is all of the machinery and everything you use actually in there, or is it something you bring along? How does that all work when you get a call?
Well, there's some equipment that stays in the aircraft, but then there are bags and different pieces of equipment that are pretty portable. So if somebody is in a car crash, for instance, we carry our stuff outside of the helicopter, go to the patient, get the patient stabilized somewhat, and then get them back to the aircraft. So most of our equipment does stay in our aircraft, but it is portable just depending on whatever the patient needs.
And I was going to say, depending on what the patient needs, how do they know when to call you all in? I mean, under what circumstances do they call you guys?
Sure. So we actually educate our ground EMS providers and our fire departments, and we give them a list of criteria. So someone who's not breathing well, somebody who's been in a high impact motor vehicle crash, someone who is having a heart attack based on an EKG that maybe an EMS provider has identified. Those are some of the criteria that will activate us, but we do education with those folks out in the community to help them help us get the right patients.
Okay, sounds good. Very nice to meet you both.
Yeah,
and congrats on 30 years.
Well, thanks.
Thank you very much.